Hello viewers, we are from SCDB1 and we are presenting our student project which will be different from the previous projects. This student project is called Case Building Learning of Prescribing Analgesic Drugs. Basically, we have to solve a case by prescribing what personal treatment and personal drug that is suitable for the patient. In this project, we are prescribing analgesic drug to the patient, which will be interesting. Without further ado, let's begin. Next slide. The case is as follows. Miss Ayu, 50 years old, 50 kilograms with chronic rheumatic disease, was treated with P drug with indomethacin, 3 times 50 milligram daily, plus a 50 milligram suppository at night. She complains of pain early in the morning. Next slide.
Thank you for the opportunity. First of all, let me introduce myself. My name is Putu Chintya Harum Rahcetag. The three last digit of student ID is 018. So now I will present about the epidemiology. Rheumatic disease is a term that refers to disorder of joint, tendon, muscle, bones, and ligament. There are many types of rheumatic disease, including fibromyalgia, gout, osteoarthritis, systemic lupus erythematosus, rheumatoid arthritis, juvenile arthritis, and many more. From all of these, the most common rheumatic disease is rheumatoid arthritis. CDC report that nearly 1 in 3 US adults are diagnosed with arthritis with severe joint pain. Rheumatoid arthritis also reported to be more common in older people at age of 40 until 60 years old, then mostly occurs in women than men with ratio 1 to 3. Next slide.
Is induced by autoreactive T helper type 1 or T helper 17 cells in lymph nodes or locally by activated antigen presenting cells or APCs that elicit autoantigen-derived peptides. In affected joints, activate autoreactive T cells activate macrophage and fibroblasts through the secretion of pro-inflammatory mediators, TNF, interleukin 17, EFN, and receptor activator of nuclear factor K-ligand or RANKL. Activated macrophage will secrete pro-inflammatory cytokines in large quantities, namely TNF, interleukin-1, and interleukin-6, which cause the formation and maintenance of inflammation in the synovial. Activated T cells also help autoreactive T cells produce anti-citrullinated protein antibodies or ACPA in rheumatic factor or RF autoantibodies. These autoantibodies further promote inflammation to direct macrophage activation. Rank L fibroblast derived matrix metalloproteinases (MMPs), osteoclast antibodies, and neutrophil mediate cartilage damage and bone erosion. The diagnosis can be done by examination, lab test, serology, and radiology. On examination, typical of rheumatoid arthritis is a symmetrical swelling of the joint with a rubbery and spongy consistency. On lab test and serology can be found increased ESR and CRP due to inflammation. In addition, show positive results of RF virology, ACPA, or both. On radiology, X-rays may reveal osteopenia or periarticular erosions, pulmonary involvement. MRI used in detecting synovitis, synovial thickening, inflammation of the tendons, erosions, and other signs of inflammation.
Okay, I will continue about the diagnosis. The diagnosis also can be made by looking for social problems that related to the disease. There are smoking habit and diet. For smoking habit, a number of cohort and case control studies show that smoking is associated with an increase in rheumatism. For diet, research show that consumption of red meat can increase the rise of arthritis, while fruit and fish oil can protect against it. After the clinician has taken a history, physical examination, and supporting explanation as previously described, if the patient is correctly diagnosed with rheumatic disease, then appropriate treatment will be given, which will be explained in chapter 4. Next slide.
First of all, my name is Devaline Ramadhan with last number 016. The therapeutic objective involves several key aspects. Firstly, it aims to achieve adequate pain relief to Mrs. Ayu by identifying the underlying cause of her morning pain and targeting it with appropriate intervention. This may involve a comprehensive assessment to determine if the pain is due to a disease activity, morning stiffness, or other factor relative to her condition. Secondly, considering Mrs. Ayu's current treatment with indomethacin, it is essential to evaluate the effectiveness of his medication in managing her pain, particularly in the early morning. The evaluation may involve assessing the dosage, timing, and overall response to indomethacin, as well as considering any potential side effects or interaction with other medications she may be taking. Based on the case, the therapeutic objective may include adjusting the dosage or timing of indomethacin to ensure optimal pain relief during the early morning hours. Alternatively, if indomethacin is found to be insufficient in providing adequate pain control during the specific time period, additional analgesic intervention may be considered. This intervention could include the addition of alternative analgesic agents such as acetaminophen or non-steroidal anti-inflammatory drugs, or exploring other treatment modalities such as physical therapy or joint injection, depending on the individual patient needs and medical history. Next.
Hello, my name is Ananda Aulia with three last digits of my student ID number is 015. In this opportunity, I'll talk about the pharmacokinetics and pharmacodynamics indomethacin. First, pharmacokinetics absorption. While absorbed, indomethacin reaches peak plasma levels in 2 hours. The bioavailability rate is almost 100%. Distribution. Indomethacin can easily pass across the blood-brain barrier due to its high lipid solubility. Metabolism. Indomethacin undergoes enteropathic circulation. Excretion. A little over 60% of the indomethacin that has been taken is eliminated in the urine by renal tubular secretion, and the remaining 40% is eliminated in the feces by biliary secretion. Next slide. The pharmacodynamics. Indomethacin works in the same way that most other NSAIDs do. The effects of indomethacin are brought on by its ability to prevent prostaglandin production. Since thromboxane A2, a crucial mediator of platelet aggregation, is produced by COX-1, inhibiting this enzyme is probably what causes NSAIDs to have antiplatelet actions. The GI mucosa is maintained by COX-1, whereas COX-2 is increased in inflammatory tissues and generates prostaglandins that cause pain, heat, and inflammation. As a result, NSAIDs that are specific for COX-2 may be less likely to cause GI adverse effects than indomethacin, a non-selective COX inhibitor. Smooth muscle is relaxed by prostaglandin E2, which also prevent the ductus anteriorus from closing. As a result of the high concentration of prostaglandin E2 in premature newborns with respiratory distress syndrome, the ductus arteriosus fails to seal, leading to patent ductus arteriosus or PDA. Differential cyanosis can be brought on by untreated PDA. By preventing the formation of PGE2, indomethacin aids in the healing of PDA. That's all from me. Thank you.
Hello, thank you for the opportunities. My name is Putu with three last digit of student ID number is 021. So I will explain about the safety. Side effect. Indomethacin is a non-steroidal anti-inflammatory drug or NSAID commonly used to reduce pain, inflammation, and fever. While generally considered safe and effective when used as directed, indomethacin, like other NSAIDs, can potentially cause side effects. Some of common side effects of indomethacin include gastrointestinal effect. So, indomethacin may increase stomach pain, heartburn, nausea and vomiting, diarrhea, indigestion, and loss of appetite. So, there is ulcers and gastrointestinal bleeding. Indomethacin may increase the risk of developing stomach ulcers or gastrointestinal bleeding, especially in people with a history of stomach ulcers or gastrointestinal bleeding, or in people taking high dose for a long period of time. Cardiovascular increase blood pressure, so that may lead to hypertension and also swelling caused by fluid retention. Central nervous system. Indomethacin may cause several effects in central nervous system such as headache, dizziness, anxiety, and also fatigue. The last one is kidney. So, indomethacin can decrease kidney function and increasing risk of kidney damage. Next slide. And then there's a drug interaction. The first one is antihypertensive drugs. Indomethacin can make antihypertensive drugs less effective and cause the high blood pressure. The second one is anticoagulant. Indomethacin may increase the anticoagulant effects of drugs such as warfarin and increase the risk of bleeding. The next one is aspirin. Concomitant use of indomethacin and aspirin may increase the risk of gastrointestinal bleeding and reduce the cardioprotective effects of low-dose aspirin. The next one is lithium. Indomethacin can increase lithium levels in the blood, which can cause toxicity. The last one is diuretics or thiazides. Combining indomethacin with thiazides diuretic may decrease its diuretic effects and increasing the risk of kidney damage. Okay, that's all from me. Thank you.
Okay, so thank you for the opportunity. Let me introduce myself first. My name is Krisnaditya Dwi Raharja with three last digits of student ID number 014. Move to the next part. This is an example of a branded medication that contains indomethacin as its active ingredient. Next slide. Indomethacin is available in various oral administration forms, including immediate release capsules, extended release capsule, and oral suspension formulation. It can also be administered through intravenous injection or rectal suppository. For this case, the best administration for indomethacin is oral administration. So why? Because it has high bioavailability, nearly 100%. In this case, the patient with chronic rheumatoid disease, oral administration was found to be non-invasive, convenient, and suitable for the patient as they didn't experience nausea or vomiting. Oral administration of indomethacin is conducive to self-administration and is appropriate for long-term management of chronic disease such as chronic rheumatoid arthritis. Okay, so next slide. The recommended administration of indomethacin is 25 mg orally 2 to 3 times a day using an immediate release formulation. The initial dose is 25 mg and it can be increased weekly up to 50 milligrams. The maximum daily dose of indomethacin is 200 milligrams. For patients with arthritis or experiencing night or morning stiffness, an additional 100 milligram can be administered at bedtime. So that's all from me. Thank you, and next slide.
Thank you so much for the opportunity. First of all, let me introduce myself. My name is Rahcetag Manurung with the last digit of my student ID 030. So now I'm going to tell a bit of the durations of using indomethacin. So using indomethacin, it depends on individual condition and it will be instructed by the doctor. It is very important for us to know that using indomethacin should be in the proper durations, not for taking a longer time than it is prescribed for the safety and also effectiveness of the medicine. Also, for avoiding the possibility of the negative effect. Next slide. Also, I will continue with the contraindications of the indomethacin. So there are three contraindications. The first one is the hypersensitivity to the indomethacin caused by the non-steroidal anti-inflammatory drugs or NSAIDs. For example, in patients with asthma, NSAIDs can induce an allergic reactions by inhibiting the production of prostaglandin. Due to its inhibitions, the wall of the respiratory tract will induce the buildup of white blood cells that release chemical substances that cause an allergic reactions. For the second contraindications is a patient who having a after coronary artery bypass graft or CABG surgery. And based on the two large clinical trials of using NSAIDs during the first 14 days after CABG surgery, it is reported there are increasing frequency of myocardial infarctions and also stroke. The last one is indomethacin contraindicated in the beginning of the third trimester in pregnant women. It is because of the use of indomethacin may result in the fatal ductus arteriosus prematurely closing. I think that's all for me. Thank you. Next slide.
Okay, thanks for the opportunities. In this section, we will talk about what kind of P drugs that is suitable for the case. For that, let me introduce myself. My name is Aji Maridi Pasta with my three last digit ID number 02H. So now, let's see how to determine the drugs of choice for patient. There are three potential P drugs grouped for the patient. They are non-steroidal anti-inflammatory drugs, disease-modifying anti-rheumatic drugs, and corticosteroid. From three of them, the MIRD has the best efficacy but with high costs and also has a long time of therapy management. Corticosteroid has more side effects than its benefits, so that NSIAD group will be the right choice for patient treatment because it functions as antipyretic, analgesic, and also anti-inflammation. In the NSIAD group, we select three kinds of drugs that is most frequently used for the treatment of rheumatic disease. They are ibuprofen, naproxen, and indomethacin. Actually, three of them has the same potential P drugs because their efficacy are similar. But the difference is indomethacin has more stable half-life duration than others. Ibuprofen has advantage from the safety and cost aspect, and then if we choose naproxen, it will need an additional compound to make a good drug. But the endomethacin is most suitable for patient because it can cure the early morning pain from the patient. So that endomethacin is the right P drugs for the patient. That's all from me. Thank you. Next slide.
Hello, my name is Sp.MK with last digits of student ID is 025. Indomethacin cost. Indomethacin cost depending on the pharmacy you visit. For 30 capsules, 25 milligrams indomethacin oral capsule costs about 200,000 rupiah. 50 milligrams indomethacin oral capsule costs about 230,000 rupiah. And 75 milligrams indomethacin oral capsule costs about 600,000 rupiah. However, the cost of 1 milligrams indomethacin intravenous powder for injection is around 5,800,000 until 8,200,000 rupiah. Comparison with the other drug. Based on the case above, the dose of indomethacin used was 50 milligrams 3 times daily. The cost for this dose in a month is about $20. In addition to indomethacin, ibuprofen and naproxen are generic NSAID drugs that can be used to treat rheumatic disease. The recommended dosage of naproxen for rheumatic disease is 500 milligrams every 12 hours, so the cost need in a month is $18. Meanwhile, ibuprofen for rheumatic disease can be taken up to 800 milligrams 3 times daily. In a month, it costs $16. Consequently, indomethacin is more expensive than ibuprofen and naproxen. Thank you, and next slide.
Okay, thanks for the opportunity. My name is Gede Indra Prabawa Putra, and the three last digits of my student ID number is 022. In these occasions, I would like to describe about the prescriptions. So this is the prescriptions, which is composed of several parts. The first one is the prescriber's identity, which includes names, license classifications, address, operating hours, and the prescriber's phone number. Next, we have the place and the date of the prescriptions, which is in this case is written just below the prescriber's identity on the right hand side. Next, we move into the main parts of the prescriptions. This part always begin with the R letter, which stands for recipe. The R letter is then followed by the inscription, which includes the drug names, which is indomethacin, the strength in metric unit, which is 50 milligrams, and the quantity, which is 30 in this case because the medications is intended to use for 10 days. The next part is the signatura, which is essentially the instruction for the use of the drugs. TTD caps once here means that the drugs must be taken 3 times a day and one capsule each time the patient takes it. PC here stands for postnam, which means that the drug must be taken after a meal because indomethacin is non-selective and SID, so it may increase the gastric side effect if the patient takes them on empty stomachs. Okay, we just finished the first part, so we will move to the next part, which can be interpreted in similar way as before. The drug is the same as before, which is indomethacin. The strength in metric unit is 50 milligrams. The dosage form is suppositoria, and the quantity is 10. The signature just below it means that the drugs must be used once a day and one suppositoria each time the patients use it. HP here stands for Harum Vespertina, which means that the drug must be taken at night. The last part is the patient's identity, consisting of the name of the patients, uh, age and body weight, and also the address. Okay, that's all from me, and thank you. Next slide.
Hello everyone, my name is Refferty with the last digit of my student ID 003. Indomethacin is used to relieve swelling caused by rheumatic disease. Indomethacin is in a class called NSAIDs. It works by stopping the body's production of a substance that causes pain, fever, and inflammation. As a doctor, we must instruct the patient to take indomethacin capsule 3 times daily after having a meal and suppository once a day at night. We must ensure that the patient takes indomethacin exactly as directed, no more or less. Next slide. We must warn the patient about the side effects of indomethacin so that they know about it and make discretionary decisions. When taking indomethacin, they may encounter side effects such as headache, vertigo, epilepsy, and etc. We must also warn that when not followed as instructed, consuming this drug may make the patient have a higher risk of heart attack or stroke, stomach ulcer, and gastrointestinal bleeding. Like many medicines, we must monitor the patient for any side effects, and we may change the dose regimen if needed for better management. We must prohibit the patient from driving a vehicle if the drug is taken recently, because indomethacin may make the patient drowsy. That's all from me. Next slide.
Thank you for the opportunity. My name is Sienny Kuswardi and the last three digits of my student number is 004. Let's continue to chapter 6, which we will talk about the evaluation of the patient. First, we need to regularly monitor her condition. As previously mentioned, indomethacin usage in some situations requires patient monitoring due to the medication's numerous possible negative effects. Without any prior symptoms or indicators, serious gastrointestinal bleeding, hepatotoxicity, and renal damage can happen. Therefore, if indomethacin is administered long-term, checking the patient's CBC and chemical profile should be done routinely. Taking indomethacin for a long period of time may increase the risk of heart attack, stroke, and blood clots. Next, we'll talk about ending treatment. If medication fails to prevent or slow rheumatoid arthritis, a surgery may be considered to repair damaged joints. Arthroplasty will be needed to replace some part or all of a joint. So the surgery may involve other procedures, such as synovectomy, tenoplasty, osteotomy, and joint fusion. That's all from me. Thank you.
That's all from our presentation about the student project. We are sorry if we had said something wrong or not appropriate. And thank you for watching.